In this video, we'll talk about labor. At 37 weeks and above, it's considered term. So anything below that is considered preterm delivery. And to see if mom is in preterm labor, you can measure fetal fibronectin. Now, anyone that is delivering preterm, you have to give them betamethasone, which is steroids, and you also have to give them penicillin for group B strep positive or if they're GBS unknown. Now, if they're 36 weeks and below, you don't have to give any tocolysis, just the steroids and penicillin. If they're 34 weeks and below, you also have to add on tocolysis, and you do that with nifedipine. If they are 32 weeks and below, you add on magnesium for brain development. And it's important that you give indomethacin for the tocolytic 32 weeks and below, and nifedipine for 34 weeks and below, because indomethacin will close off the PDA if you give it after like 34 weeks. Now let's talk about the delivery itself. So there's two stages of labor, stage 1 and stage 2. Within stage 1, it's split up between a latent phase and an active phase. The latent phase is from the cervix being dilated 0 centimeters to 6 centimeters. This can take some time to get to 6 centimeters, and that's fine. You don't need to intervene. But once mom is dilated 6 centimeters, then she's considered being part of the active phase of the first stage. And this is where you need to monitor how quickly she's dilating, because you would need to intervene if she's dilating too slowly. You should be dilating at least 1 centimeters every 2 hours. If that's not happening, then it's considered protracted labor, and you can augment with oxytocin. More specifically, if there's no cervical change within 4 hours of having good contractions that are at least 200 M units, or having no cervical change with 6 hours of no contractions, then you have to send the mom for a C-section. Now let's say she's progressing labor fine and she reaches 10 centimeters. Now she's considered being part of the second stage of labor, and this is when the pushing starts. So if the baby doesn't descend further down or come out within 3 hours of being a first-time mom, or within 4 hours with having an epidural, then you need to send the mom for a C-section. Some risk factors for this arrest of second stage are maternal obesity, excess weight gain during pregnancy, having diabetes, or having an epidural in. Another very common cause of arrest of second stage of labor is cephalopelvic disproportion, which just means that the baby's head is too big for the pelvis. Also, moms can get very tired with pushing after several hours, but if the head is almost there, you can do an operative vaginal delivery with vacuum-assisted delivery instead of having to send them for a C-section. So after delivery, you can have postpartum hemorrhage, and the definition of that is losing more than 1,000 milliliters of blood. The most common cause of postpartum hemorrhage is uterine atony, and you'll know this is happening if your uterus is soft and boggy and it's above the umbilicus. To treat uterine atony, you can do a bimanual uterine massage. If that's not working, you can give oxytocin to make the uterus contract, and then that should stop the bleeding. If that's still not working, you can give tranexamic acid, or you can give antifibrinolytic agent. There are other causes of postpartum hemorrhage, so you can also give uterotonics, such as methylargonavine acid, but this is contraindicated if the mom has high blood pressure. You can also give carboprost, but that's contraindicated if the mom has asthma. And another thing you can do is tamponade out the bleeding with a intrauterine balloon. If all of these things have not stopped the bleeding, your last two options are uterine artery embolization or hysterectomy, but this should be last resort because then the woman couldn't have kids after this. Another complication after delivery is uterine inversion, and this occurs when you're putting too much traction on the cord during delivery, and you'll know this has happened because the mom will have severe abdominal pain, she'll have heavy bleeding, and you won't be able to feel the uterus at the fundus anymore. And to treat this, you stop the oxytocin and then you manually push the uterus back in.